Yeah. Welcome to the Voice of South Pacific, a Pacific Islanders broadcast from Seattle, Washington at Manamo'i Center. Today we find the great opportunity supporting from Seattle and King County Public Health to share, especially to the Pacific Islanders communities, about the chemicals and PFAS, of how to better and more efficiently detect and measure PFAS in our air, water, soil, and fish and wildlife. So today we have the expertise, which is Dr. Shirley Tan and also Sam Lowell from the Seattle and King County Public Health. We have a lot of the co-hosts that will be joining us with us in a few seconds. But in the meantime, we'd like to give this great opportunity to introduce Dr. Shirley Tan. Welcome to the Pacific Islanders broadcast. Thank you so much for taking the time to be with us today. Also, Talofa Longo, thank you for joining us. And also, I know that there is about like 6 more people that are going to be joining us very soon. And then also, I have Sam Lowell. So because of our very relevant, great topic for us today, and then everybody's going to speak and they are going to share something in their native language. So, because of this great topic, ke kainga tonga o ko loto ke o ate whakamali ko ni, ke mō ngawe aki, ke mō whanongo, ke whakapota la noa ko ni o whikau aki pia moe ke mikale, o ku ihe e tau mea toko ni, o ku ihe e tahi ihe vai, mo ngahi tawha aki ko toa pe, o hao ki he ea. Pea o pere pere ngese, kune whakatupa e kansa. So all these things, can also, the more we expose to it, then it's causing, some chronic disease like cancer or various other things. So in the meantime, I'll give this to the expertise, I would like to, while we're waiting, for everybody to join in, how to better and more efficiently detect and measure the PFAS in our air, water, soil, and fish and wildlife, and also how much people are exposed to PFAS, how harmful PFAS, and how to remove PFAS from drinking water. So at least, whatever you feel like you wanted to share in the beginning, we'll let you go ahead. Oh, we also have like Vicky Navarro, and Dr. Pakieli Havili Kaufusi, he's also an islands doctor, and he also talk about like the health every week, to our communities. But I'll let you, since our topic it's about the PFAS and chemicals, I'll let you start with, welcome to this great topic here with the Voice of South Pacific broadcast. Please, everybody, share it, to your Facebook and all the social media connection to everyone in the community to hear, near and far. Dr. Shirley Tan, thank you and welcome.
Thank you. Thanks for having me here today. I know I've been here before to speak to you about PFAS chemicals, and I'm back again today to talk a little more about them. I think it's always good to hear about different chemical issues more than once because it can be complex, and I think I learn something new every time I hear about them. So for those of you that are not familiar with PFAS, they are chemicals that are used in products and in processes to make things either water resistant, stain resistant, or non-stick. Can you hear? I think there's some extra noise. So
mute your button,
so the chemicals that do this are called PFAS chemicals, and they are a class of about 12,000 or more chemicals. So there's a lot of them, and they're used in a lot of products. And the problem with them is they are also known as forever chemicals because they do not break down. Like you could release them into the world, and they have been released into the world, and they will be there longer than we will be on this planet, each of us. So this is part of the problem with these chemicals. They don't break down, and we have them everywhere now, and we know that they have some impacts that can be harmful to human health and environmental health. So part of our efforts here in Public Health Seattle King County are to better understand how they impact health and help our residents to avoid being exposed to them in the first place. So I guess that's a
Oh,
little introduction, and hopefully that sets things up for a nice discussion.
thank you so much, Dr. Shirley Ten. Again, the topic today is about, PFAS and forever chemicals. A lot of time we're not even aware that we're dealing with the chemicals. So, but this is very, very important, that we aware that we having the chemicals around us all the time. Maybe it's in the air, or maybe like, hangi ko kai nga tonga tem lai foki hangi ko lingi si ma mga me ko ya. A lot of our communities doing, like construction work and also like pouring concrete, and those are, exposing, to a lot of the chemicals too. So I will ask, the first question. Oh, I have another one here. Oh, Lydia. Oh, Lydia, yeah, whenever you have the question, please raise your hand. And if not, you can always write it. But I'll give the first opportunity because Lydia is asking me, that she wanted to ask the first question. Lydia, go ahead. Lydia is from the islands of Fiji, and she's the lead of the netball, sport here in Washington. Lydia, can you hear us? Unmute your. Lydia, can you unmute? Lydia Faitalia. Oh,
Hey,
sorry, that Lydia.
yeah,
Lydia is one of our people that representing us. It's the commissioners. At the governors. She's originally from the islands of Samoa. Lydia, do you have a question at the meantime to ask or?
thank you. Thank you, Sylvia. Good afternoon, everyone. My name is Lydia Faitalia. I received a meeting request today. If I can just have several minutes to settle in, and then I will go ahead and ping the host and let them know that I'm ready. If I can just have a couple minutes.
Okay.
Thank you, community member Sylvia.
Okay, thank you. Also, while we're waiting, I see a lot of hands, already raised up. Sam Lowell, thank you, welcome because you're also from Seattle and King County Public Health. Sam Lowell, can you introduce yourself too?
Yeah, thank you so much. And it's wonderful to return with Shirley today. I'm Sam Lovell. I do communications for public health, so focusing around communicating how how people can make sure they're protected from chemicals and other things in their environment. So yeah, thank you for having me.
Okay, you're very welcome to the Pacific Islanders communities. Okay, and then we have Dr. Pakieli Havilikafusi. So always have a lot of great advice, for our people to be aware of. I'd like to introduce Dr. Pakieli Havilikafusi. He's also like a medical doctor, and our people are very blessed, that he comes in every week and try to advise them of how health advice. Dr. Pakieli, I'll give you this time here before we continue on, and the next will be Vicky Navarro.
Thank you, Fatima, and thank you all for being here today. Thank you, Shelley. Good to see you again. And also, Sam, coming with all the great information. So I'm happy. I work for the medical school here in Hawaii, the University of Hawaii. And I do a lot of research for chronic diseases and all different kind of research related to health. So I'm happy to share and learn some important information from Shirley and Sam today. Thank you.
I want you to ask a question. Yeah?
Hi, everyone. I'm Vicky Navarro. I'm one of the 22 bilingual community navigators here in King County. I also run my own nonprofit, which is called Building Beyond Communities, where we host resource fairs throughout the county, and then also a project monitor for the Fun to Catch, Fun to Eat program for the PI and the Filipino community. So an honor to be here today. Thank you.
Okay, well, thank you so much, and now gonna back to, to one of the questions, like that, everybody like to hear that. How can people be exposed to PFAS?
Great question. So I think most people that are exposed to very high levels are either exposed because their drinking water is contaminated. Um, we have a lot of drinking water across the country and actually internationally that has been contaminated from firefighting foams that were used in the past. The firefighting foams now, in the recent years, have been converted to safer fire foams, but in the past, they all had PFAS in them. And so when there was a fire or when firefighting facilities would practice firefighting, just to be safe, to know that they were ready if there was a fire, they would release the fire foam into the environment when they were practicing, and it would seep down into the ground and get into the groundwater, which is often the drinking water for a lot of communities. So that's one of the main ways people in the US have been exposed to high levels of PFAS. There also can be occupational exposures if you're working in certain occupations, such as chrome plating, or if you work for a manufacturer of PFAS. Luckily, in Washington State, we do not have any PFAS manufacturers. And in King County right now, at least in public drinking water sources, we do not have any high levels of PFAS in our drinking water. So I think in King County, we're in pretty good shape. But we are all exposed to PFAS through the products we use. And probably every single one of us does have PFAS in our blood. If we were to test our blood, we would find that we have PFAS chemicals in our bodies. But these are not levels that are as high as individuals who have had their drinking water contaminated, for example. These are baseline levels that probably most Americans have. So that is why we in King County Public Health are concerned about PFAS in products, and we work hard to try to understand what products have them, how we can reduce our potential exposures, and work with the state to try to push for regulations to get them out of products.
Okay, thank you so much. Okay, just make sure, when you're ready to ask a question, you can always raise your hand, and make sure you go into all your social media and share it, with all your friends. We're going live also on Facebook and YouTube. Okay, I see the boat from the islands of Fiji just finally arrived. Okay, welcome, Pulavinaka. Lydia, I'm glad you're able to join us. She's also like a leader of the netball sport. Lydia, can you hear us?
Hi, everyone. Hi, ma'am.
Hello.
Bula.
Yeah, are you ready to have a question to ask?
Yes, thank you. Thank you very much, Pulavinaka, to our sister that just joined us. Aloha malo ele. Thank you for your patience as I got settled in. Dr. Tan, thank you for answering the first question. My follow-up question to that are very high level. Is there products that, like, can you name off some products that you are advocating for with the state to have like restrictions around?
Yes. So I would say one product that we are very focused on right now is cookware. We know that nonstick pans can have very high levels of PFAS. We don't know how much of that gets out of the pans. They're most likely fairly safe for humans unless they get scratched or they're heated to very high levels. And so if you put it in your oven and you're cooking something or you have it on the burner and it gets quite hot, most likely PFAS are released, and we know that they are used at very high levels in those nonstick pans. We also know that there are a lot of safer alternatives that do not have PFAS in them. So, for example,
And a team of 5 account.
I use mostly cast iron cookware because it has no PFAS in it. It also is free of lead, which is another contaminant we worry about in cookware. But also stainless steel is great. There's also carbon steel pans. And so those are good options if you're worried about the cookware until we can get a ban passed in our state. Yeah. I would say other things to just look out for that we have been pushing to get PFAS out of are anything that says it's nonstick or stain resistant or waterproof. So we've been working hard to get PFAS out of like rain gear, for example. We know there's a lot of new alternatives that are safer, like the way things are constructed, they can be just naturally water resistant. And we've already gotten some really great legislation in our state that has been passed to remove PFAS from things like food packaging, cosmetics, stain resistant treatment. So if you want to make your shoes water resistant, there are now treatments that you can use that are PFAS free. And so we've advocated for the state to try to make those the ones that are required to be sold in our state, not the ones that contain PFAS. So there's a few examples.
Can I piggyback on that question as well? But does that, even if you're not, even if you're wearing it, how does that expose? Does it go through your skin, or is it inhaling, or what is
Yeah.
the way of that PFAS coming in through your system? Thank you.
Yeah, that's a really good question. We know that PFAS are likely they could be absorbed by your skin, but it's a lot less likely. The biggest source of exposure is through ingestion. And a lot of people don't think about how ingestion includes inhaling dust or fumes. So we know that like if you are wearing a nonstick or a water resistant piece of clothing or clothing that's treated with PFAS, and then you wash them, and you put them in the dryer, they can come out in little particles in your clothes that go into your dryer lint. So then when you remove the dryer lint and you clean that out, it makes a big puff of dust that you most likely inhale. So that's one way we're worried that people get exposed. Yeah, and then, for example, with a nonstick pan, if it gets very hot, we don't know. We know that in the past, there's been this reporting of people that have birds and they're cooking in their kitchen and suddenly their bird dies. And it turns out those bird deaths were because PFAS fumes from people cooking with nonstick pans. And we've also heard reports of people getting feeling kind of nauseated or sick from their pans. So we expect that there's some volatilization and people do end up inhaling that in certain cases.
Thank
And
you.
then of course, if it's in your water, you're directly ingesting it, or if it's in your food. Yeah. Yeah.
Hello, thank you so much, yeah, for asking those questions. And now, because we have two Lydia Faitalia, the Samoan, and in the Kappa, and now we have the Lydia Taungunu from the islands of Fiji. She's been racing, and then after that, we'll go to Yulongo, and then I see Emma Maria is in there, and then whoever have the next question, and then we also have Dr. Pakeli Habilikafusi, that's our island's doctor. Lydia Taungunu, go ahead.
Thank you, Ma'am Sylvia. Ma'am, what you have just explained, it's really very interesting because this is something that we encounter every day, and it's sad that most of us have lack knowledge about what we have just shared to us. Just my question, this PFAS, it's called at times forever chemicals. Why are they called that way?
Yeah, that's a very good question. There's multiple reasons they're called forever chemicals. The first is because we know that they contain a bond of fluorine and carbon in them. They all have at least one of those. Most of them have many. And that is one of the strongest bonds in nature. So they don't break down. And in addition, they're not seen naturally in nature. This is a synthetically produced chemical bond. So you wouldn't normally have it if we didn't make them in a factory. So because they don't break down in our lifetimes, they're called forever chemicals. And then some people have said when that name came around, it's because there's an FC bond, fluorine carbon bond, and that FC also symbolizes forever chemical. But it's a good way to remember that it's the fluorine carbon bond that makes them so long lasting.
Very attractive names to remember. Forever
Yeah.
chemicals. Yeah.
Yes.
Thank you.
Yeah.
Thank you.
Yeah, I just want to add on to Shelley's answer. The whole purpose of many of the manufacturers using this chemical is because to increase the life and also stability and also the spread of a lot of chemicals that we are using, because they are not breaking down easily, like Shelley is talking about all the bonds and stuff like that. So that's the main reason why they are using in, like in the pots at home that we are using. So make sure the food does not stick to the pot and all those kind of stuff. Yeah, so even the cream that we are using, like it helps to spread evenly well on your body. Even the floss, yeah, the floss that we are using also contains some. So let me name some of the products. Actually, the cleaning products Pacific Islanders normally use that have high on this one: the dish soaps, the carpet cleaners, also the odor removers that we use at the house, shower curtains, the even the stain-resistant carpets and rugs, the mattress, and even the bedding material, shaving cream, sunscreen, cosmetics, tender, I say tender floors as well. Also the household chemicals like fabric protectors, a lot of Pacific Islanders, they clean the cars, especially car waxes and sealants to make it shiny. The floor waxes and polishes, even waterproofing sprays. But the main thing I'm little concerned about here, Shelley, is the microwave popcorn bags. Yeah, I also read about it that it's very high PFAS. So can you please help on that? Even the fast food wrappers also have a lot of these PFAS. Can you please comment on those stuff, Sherry? Those are the products that us Pacific Islanders we're using a lot. So I'm just highlighting that so that you can make it easy for your
Yeah.
experience. Thank you.
Thank you. Yeah, those are all good ones to highlight. There's so many. The popcorn bags, I think the reason there's PFAS in there is because you're putting it in the microwave and it's getting to a very high temperature. So it's I think to some extent helping it to keep from catching on fire, but also its non-stick properties. food packaging traditionally had a lot of PFAS in it. Washington State banned them, at least in food packaging that's fiber-based. So they should be out of that food packaging in Washington State at this time. And I know at the national level, the FDA did a voluntary phase out in food packaging. And I believe, even though that's voluntary, which doesn't mean a lot in terms of like being required to take it out of the food packaging. But I think in recent tests that have been done, they're not seeing PFAS in very much food packaging. So that, at least take out food packaging. So that is good. Yeah, so I think that on food packaging, there's a lot of different states that have banned PFAS in food packaging, food takeout containers. And so I think the impacts of that, and Sam put some information in the link in the chat. But I think the pressure from so many states have pushed manufacturers to try to just take it out because they don't want to have to make a different product for every state. It's just easier to make one product that they can then sell to all states. So the more each of our states pushes to get PFAS out of products, the more effectively we can ban it nationally.
Thank you so much, for answering, and clarifying all these things, that causing all the PFAS that we're not aware of. There's just a lot, for us to learn. Ko hange ko na tu ko atu ko ngai me alahi o kai kem kare I he vai ba me akai ko ki tau hanga tau tolo fa to kanga. So I'll give this opportunity to you, Longo. You have the question about asking about the PFAS or the chemicals. Okay. While Longo is ready. Longo, are you ready? I'm going to give this opportunity to Emma Maria. Emma Maria?
Yeah, I just have a quick question. Do you know, Shirley, if there has been any follow-up on testing for kid-friendly um items, maybe like carpets? I know that that's a really big important item that a lot of families use, especially during crawling time.
Yeah, that's also a really good question. PFAS has been in our state restricted in carpets, but that doesn't mean it's fully out. I think there's a phase-in period, and there's, of course, a lot of us have carpets still in our houses that has PFAS from historical use. We in King County have been doing some testing on carpets. We're trying to develop a method that is similar to how we test for lead in products. It's using this XRF gun that shoots items with radioactive electric energy and can excite electrons in an item. And then we read the electron signature and we can tell what elements are in it. So we're looking for fluorine in items. We're still trying to optimize this method, but in the process of developing this tool, we've done a lot of testing through other methods that are very well tested and well known. The good news is we tested a lot of children's products. We went out and we kind of we did surveys with communities and different like children's groups, children daycare providers and other children's groups to get ideas of what to test for. And luckily, we did not see a lot of PFAS in the children's products, but we are doing additional testing. We're just starting to order more products now. Carpet is one of those, children's play mats, children's carpets, and we're doing some more work on just carpets in general because we know there's still a lot of carpets out there that have PFAS. So the jury's still out on those, but we hope to have some data on that in the next 6 months. So check back with me at that point. But in the meantime, if you have a choice between purchasing carpet or not. I would say hard floors are better because they're just easier to clean. You can keep them dust free. They don't generate dust that you then inhale. And no matter whether the carpets have PFAS in them or not, they still generate more little dust particles that you can then inhale. And they may be made of natural materials like wool, but more often than not, they're made from fibers that probably contain plastic and other chemicals in them. So, yeah.
Thank you, Dr. Shelley. Before we continue on, I would like to give this opportunity to this person here. Was waiting. Her name is Amelia. She's asking. She heard the discussion, and I think she missed that. About all the chemicals and the PFAS, what are the potential health that causing by chemicals, like some chronic disease? Can you please share that?
Sure. So you're asking what kind of diseases can
Right.
chemicals in general cause,
Right.
not just PFAS?
She said that her auntie just have cancer, but
Yeah.
she didn't
Okay.
know. Yeah, that's
Yeah,
a
it's
causing.
very difficult, and I think this is part of a lot of the manufacturers know that it's hard to trace one chemical back to a disease. Um, so often when we're thinking about disease and chemical exposures, I like to do a demonstration or talk about the idea of like you have a cup that is your risk cup, and the risk, if your cup gets full, your risk of getting a health outcome is high. So if you try to keep your cup less full, you're reducing your risk. And that cup can be filled with everything you do. So for example, if I were to give you a bunch of M&Ms and I said, hold your cup and start putting M&Ms in, if I ask you certain questions and you answer yes, like for example, if I asked, do you smoke? Then put 5 M&Ms in. Do you keep your house clean? Do you like dust and mop your house, wet dust and vacuum your house frequently? Then take a couple M&Ms out. Do you go, um, and so you could go through all these like questions. Do you live next to a PFAS manufacturer? If so, put in 10. And so we could go through all these questions about lifestyle. Are you in an occupation where you're exposed to a lot of chemicals? If so, yes, put some M&Ms in. Do you go for medical checkups regularly? Okay, then take some out. So we could go through a series of these kinds of questions, and at the end, you could look at your cup and you could see if it's getting very full or not. And then you could say, I have this disease, which one of those M&Ms caused the disease? Well, you couldn't say that one M&M, one chemical exposure caused the disease. It's very difficult to do that. It's a mix of all the things that you're exposed to and the stresses you have on your life and a little bit of genetics and the good habits that you have kind of keep that um, cup risk lower. So it's difficult to be able to, that's one of the problems we have in the field of toxicology is really truly finding the cause of one chemical to a disease. It's usually more than one exposure, unless it's a really high exposure and we're seeing it in a community that's, for example, living right next to the factory or yeah, it's a complicated, very complicated question.
Yeah. Yeah, thank you, Shelley, for answering that question. And I'd like to add on to the question because I'm a researcher as well. So I'm going to help in explaining it in the context of understanding for my Pacific Islanders. So I'm going to make it in a very simple way. Like Sherry said, that this chemical is actually stay in your body. Your body is not really good in removing PFAS from your system. So, and we have shown from a lot of research that the problem with PFAS, they stick to the protein in your system. And most of the things that runs in your body is it's driven by proteins, and especially in the liver. So there is a likely link between this PFAS chemical, like Sherry says, it's hard to correlate the two, but because they bind to these important, as we say, the workers, because everything that runs in our body is actually depend on proteins. And so those proteins and PFAS, they bind to each other, and it's really hard to come off of it. And so a lot of people that may experience liver cirrhosis or all the cancers that actually associate with liver may amplify by PFAS. Yeah, because in our liver, some of us Pacific Islanders are hepatitis P carrier because we did not vaccinate, for especially those that were born in a island nation before moving to United States. So, so that may amplify. Also, people that are suffering with kidney problems, so PFAS can amplify it because the kidney refuel and when the PFAS comes along in your bloodstream and filter in your kidney, it reabsorbs back to the system from the kidney. So with that kind of doses of PFAS in your system, your kidney can also be affected. How about in your because they are staying in your blood vessels, in your blood in circulation. So most likely people can also, because they are attracted to all the proteins and even the fats that are circulating in your system. So because of that, there may be likely contributing factors to high blood pressure and all those other chronic diseases. So those are the kind of things that we have to be aware of. It kind of PFAS is really something that may amplify our, especially for with the chronic diseases that most of us Pacific Islanders are suffering, like diabetic, liver problems, kidney problems, high blood pressure, heart problems, all those kinds of diseases are actually linked. There is a link to PFAS as well, but they so hard to really take one PFAS compounds and link it directly to a specific disease, because disease in your body is very complex. Yeah, like Shelley said, it's not just one contributing factor, it's a multi-factor. Yeah, in order to come up with a disease in your body. Yeah. So the problem with PFAS is staying too long. As you know, PFAS is a chemical, and when a chemical is binding to all the good people in your system, you'll affect their roles in your system. So they are likely that you'll be vulnerable to infection, vulnerable to all other different diseases. So that's really the explanation for that. Hopefully, if you have any other questions, we can try our best to try and explain it. Thank you.
Okay.
Yeah.
Yeah. Um, Vicky, it looks like you're ready to go.
Yeah, I do have a question. Because, as far as like, people who never heard of PFAS, because it's not a common word that we use in every
Exactly.
day, especially with our culture community. How can you know if water or food has PFAS in it? Especially like we don't read labels in certain when we're buying ingredients and stuff like that. And yeah, can you kind of elaborate on what to look for and what can we do to also check for? Thank you.
Yeah. Well, even if you were to read the label, you would not be able to know if there's PFAS in the product. There's no requirement that manufacturers label when they put PFAS in something. Um, as far as water goes, in King County, we have some of the best tap water in the country in King County. It comes from a really clean source that's very protected. There's a lot of natural land around it that's fenced off. So like there's no manufacturers, there's no factories, there's very little ways for that water to get polluted. So we're very lucky in our region to have good tap water. On top of it all, our state Department of Health passed regulations that public water utilities need to test for PFAS starting this year. And they have a dashboard, which I or Sam can put in the link, but you can check your zip code and you can see whether your utility has tested the water and you can see what the results were. So at this time, I checked today, there are no utilities in King County that have levels that are above the regulatory safety limits. So that's good. We have good water. And I think when you're looking, a lot of people think that bottled water is safer because it comes in a bottle, and you would think that the factory that made it would have to like check it and make sure it's safe. But they don't test that water very often for chemical contaminants, certainly not PFAS. And we do also know that water that comes in a plastic bottle has a lot more plastic particles in it than tap water. So I really recommend you buy tap, or you don't buy tap water, you use your own tap water. And if you're worried about your tap water, you can filter it. There's no risks to filtering your water if it gives you peace of mind. But our tap water is quite safe. If you're on a private well, that's a different question. Then I think that's a different conversation where you would probably want to maybe test your water yourself and see if it has PFAS in it. But if you live in the Seattle area, I think you're most likely on public water.
And what would your recommendation be of if you lived in an older home, especially with the pipes being so old back then? What would you recommend? Just using like a filter on your? Yeah, thanks.
Yeah, I recommend using a filter in that case because it gives you peace of mind. You could have your water tested for lead to see if it comes back with lead, but if you use a filter, you know you're getting a lot of things out. But you need to use the right filter. So not every single filter is the same. And the State Department of Health has also a link that I can put in the chat, unless Sam has it. I don't know if you have it, Sam, but that has recommendations on which water filters are best for PFAS. And then there are some that are also good for PFAS and lead. So, and we can also answer those questions if you're looking for a water filter at some point. And I didn't talk about food. Food, it's hard to know if your food has PFAS in it. If it was grown in a part of the country where the water is contaminated and you end up eating that food, it's really hard to know. Most likely the food that you eat would have PFAS in it from the food packaging or your nonstick pan when you cook it. So yeah, just try to, and the processing. If you're eating processed food, you don't know what kind of processing manufacturing machinery is used in the factory. And we do know, like in the past, we've seen different types of contaminants in, for example, cheese from mac and cheese, because it's ground with a grinder that maybe had released some plastics into that product. So I think reducing the amount of processed food you eat and getting a nonstick pan that's not treated with PFAS, like get a cast iron pan or a stainless steel pan can help reduce what gets into your food.
Thank you. I was just also thinking about like when we, look into like a grocery store and we, would it make a difference when they say organic or
Exactly.
best choice as far as like ingredients? Will that
Yeah,
eliminate some of the PFAS? I'm just kind of just thinking out of the box as well.
yeah,
Yes.
actually
Great
it's a good
question.
it's a good idea. It's a good question. We know that PFAS are in a lot of pesticides. And if you eat organic, they haven't been treated with as many pesticides. And we also have seen studies where people that eat a largely organic diet have a lot fewer pesticides in their blood. So that's one way to try to reduce not just PFAS, but other chemicals like pesticides.
Thank you.
Yeah, thank you so much. Did it answer all your question, Vicky? Vicky is one of the biggest, King County Public Health navigator, and she does that, almost like 2 events a day, everywhere. And now you're gonna be more aware, of the chemicals that we're dealing with. It's in the air, it's in the food, it's in the water. Yeah. Longo, before we continue on, I just wanted to ask this question. This is from Osaina. She asked, she has a water, it's called Kenken water. Is it safe? It's like it's a 9.5 filter. It's tapped into the water, the water, the tap water. Is it safe, or it still have to be have some chemicals? What is the safe way to reduce chemicals in the water to drink?
So I'm not it sounds like what you're asking is about a filter that is used to filter the water.
It's a Japanese company. They have they call Kenken water. So you buy it,
okay.
And connect it, to your tap water in a
Okay.
sink. Yeah.
Okay, yeah, some of those filters can be very effective at removing chemicals from water. I don't know that filter in particular, but Sam did put in the link in the chat a link to the filters that our State Department of Health is recommending to remove PFAS from water. So you could look at those. Think to remove PFAS, often the filters are a little more, they're more hefty than there's a lot more processes in them than some of the like water pitcher filters that you can buy for the top of your counter. But I forget what they have on their list, if there are any like countertop water filters or sink tap filters.
Yeah. As long as
But
it's safe, safer.
Yeah.
Take off a lot of chemicals and mercury. Yeah.
Yeah.
Okay.
I think
Senia, hopefully that you answer your question. And I know Longo, did you have any question, or you just wanted to tune in and learn?
I just I already somebody already answered that question, because I was gonna ask about like what kind of chemical we used for the carpet. I hear somebody was asking about that.
Yeah, there's a lot of chemicals that are you mean like aftermarket spray
Yeah.
treatments? Yeah. So that is a problem. We know a lot of folks are trying to protect their furniture or their
Yeah.
carpet to make it last longer,
Yeah.
because it saves you from having to buy furniture in the future. So
Yeah.
that is one of the categories that our state has been looking at for safer alternatives, and they have found some safer alternatives. So I don't know the dates. I'd have to check on the dates for when that ban, if it's already in effect or not, for our state. But I can check on that, and we can provide information back later on what the best, whether we have that available in our state at this point or not.
Okay.
Yeah, I do know that similarly for treatments, like if you want to make your shoes like water resistant or waterproof, like I myself have looked for safer ones, and I know that Nick wax is safer.
Okay.
But I have to look to see what there is for.
Okay.
Okay. Thank you very much.
Yeah, right now time is flying. It's 3:51. We only got less than 10 minutes. And then I do see that Joseph Seia, he's the leader of the Oceania Northwest, he's joining with us. And I know he always have a great program, for the elderly, and also various other things, on a weekly basis, and also like a food giveaway. But I'll give this opportunity to Joseph, because anything about the chemicals, like we are not even aware. We thought it's just like this and this and that, but we're not even aware. It's in the air, it's in the water, it's in, in the food. Joseph, I'll let you ask the next question. Yeah.
Yeah, hey Fatima. Hi Fatima. Hi everybody. Yeah, kudos to Sylvia with the Voice South Pacific. Love the fact that you're always so relevant, Sylvia, in making sure this public health content is coming out to our various Pacific Islander communities and not just with the Tongans, but you're always asking us, the Samoans, the Fijians, the Micronesians to come along. So I appreciate you, Sylvia, and all your hard work. Thanks for always knocking on our doors. And yeah, PFAS. I mean, if it wasn't for this particular session, I would have had zero idea of PFAS. And I run Oceania Northwest, which is an organization that is rooted here in South King County and also in Everett. So we would love to, to make sure that our communities are, getting the appropriate information in regards to PFAS, and also that there's appropriate public health translations in Marshallese, in Chuukese, in Samoan, and Tongan. Those are the primary languages that we would love the translations in. But yeah, I appreciate your work, Fatima. I'm learning, and
You're
I look forward
welcome.
to exploring. Getting to get more information on it. Logo over here, she's part of our elders program, so it might be nice if anybody from the public health team can come and present to our elders as well about PFAS. But yeah, thank you guys. Fafte lava.
Hi, Joseph.
Thank you.
Okay. Yeah, thank you. Thank you, to a lot of those that are in here. We only got like 7 more minutes. Okay. There's also another question that coming from William Smith. He's asking, like he heard the great discussion, and he said that he's working with the Department of Transportation with the city, and he deals a lot. They do a lot of the things on the road, like with traffic and everything. Is there all those things, like chemicals in the air? He's just asking, or they have to wear masks. That's just a question that coming from him.
Um, that that is a good question. I think it probably depends where you are. If you're really close to like a major roadway or I-5 all day long, then you're probably inhaling more pollution than most people. But if you're in areas that are less traffic, there's less traffic, you may actually be, because you're outside, you're breathing more diluted air, so there's fewer pollutants. I think it really just depends where you are and exactly what you're doing most of the day. So it's a little bit hard to answer.
I kind of want to know, since we only have like a couple seconds and minutes, but since we kind of educated and learned a lot through this whole month, I mean, all this hour, how can we lower our exposure of PFAS? Yeah.
Yeah, we have I think, which is, I feel like it's a nice comic on this topic, that has a lot of recommendations. But I think, like, for example, you could change your pan if you have a nonstick treated pan. Like maybe think about, especially if it's scratched, like if it's scratched or chipped, then I would recommend thinking about swapping it out for a cast iron or a stainless steel pan. Not microwaving your food in plastic. That is another way that chemicals get out of the plastic and into your food. keeping your house as dust free as you can. I know I myself am not great at dusting and vacuuming often, but also just maybe being careful when you empty your dryer lint. Sometimes I put a mask on to do that just so I'm not inhaling the dust so much. I recommend, like, if you live in a place where the air is clean outside, you can open your windows and ventilate a little bit. Otherwise, can consider getting like a HEPA air cleaner to keep your air clean so you're not inhaling as many things from the dust. That's another way we're exposed to a lot of chemicals. We talked about water, so we have pretty good water in King County, but you could also filter if you're worried about old pipes or things like that. And then when you make purchases, just being really aware of what it is you're purchasing and trying to use less things that have chemicals in them. So I think we have some guidance on that, but like for cleaning products, I know cleaning products came up by Dr. Pacielli. And if you go to Safer Choice, like it's an EPA website, if you just Google Safer Choice, you can find cleaning products that are PFAS free on that website. So there are ways, and there's a lot of different websites now that have been testing products and can make recommendations on what's safer. And I think we have some of those recommendations in our comic, and we can put some in the link, probably in chat link.
Thank you. Thank you.
Yeah. Okay, well, thank you. It looks like we got like 3 more minutes, and our radio engineer wanted to ask a question. Emma? Oh, okay, Emma. Sorry, Emma, go ahead.
Thank you, Auntie Sylvia. Shirley, I was just, I mean, you kind of touched on it. I was just going to see if, before ending the meeting, you could talk a little bit about the, safer options that are available. And I know, like, you have mentioned in the past that there are some stores who have committed or who have agreed, right, to not, or to create new products that are PFAS free. But
Yeah, it's hard to find. Like, I think Sam just put the Safer Choice link in the chat. So that's one for cleaning products. And then there are now like, I forget now, there's one the Green Science Product Council has a link that we can pull up that also has commitments from either they have commitments from companies that they are not using PFAS, or they have actually provided the data, the companies have provided the data to the Green Science Product Council, and then so they've created a list with different items in there. And then there's some sites, like there's one called Mamavation. It's a woman who's tested a lot of different products. So she's showing her testing data on there, and that's Mamavation. And there's new apps out there now. So for like cosmetics and things, I know apps like Clearia or Yucca or Environmental Working Group, they have done some testing, so they are also putting some products on those. Were tags ever approved to be added to products? No, not yet. So we're hoping that sometime that will happen, but at the moment, I don't know of any. Well, that's not true. There are some tags. So like the Safer Choice logo, if you see that on a cleaning product, you know there's no PFAS in there. There's some others, which I'm forgetting now. I think Cradle to Cradle. Yeah, we'll have to put together. Oh yeah, Sam put in the blog. There's resources in that blog post that she just posted that have some of those links. Thank you, Sam, because I'm forgetting exactly what they are off the top of my head. But there's more and more every day, and our state has been restricting PFAS from products. So yeah, for cosmetics and things, we're in pretty good shape, I would say. We're starting to, those bans are coming into effect this year, so.
Well, thank you very much, and although it just like seems like there's just a lot more and more, but at least we're learning from it, the things that we're dealing with every day, like, like just even like a lot of the things that we use, like fragrance and also body lotions and all those kind of stuff. Everything goes in the air. We do like air freshener. We are not even aware that we are dealing with the chemicals. And then like the water, how do like the water and the food. So all those things, are very, very important, but we learn so much, And I saw like that one video that we did. I got it. Una, if you could just load up that video so everybody could see that, how the chemicals, it's just like on the salmon, like especially if it's not like the wild fish. It just, we're dealing with, even with the food that we put in our body, has so much chemicals and it's poisoning. It creating, some chronic disease, especially, like cancer and other things, damage our liver, our kidney, and a lot of things. So this is like very, very helpful. And we're very grateful, that you taking the time, from the Seattle King County Public Health, to educate us with the Pacific Islanders, as just take this little minute here, and you can always play it, later on, what it's in your beef, E. coli salmon and everything. We thought it's just like the food, but we're not even aware of all those things in there that can be very damaging to our body, human body. Well, thank you so much. It's about 2 minutes after 4. Thank you so much for being patient. We're going with the islands time always.
It's on my bag.
And also like Dr. Pakieli Havilikafusi and Sam Lowell. If there's anything, I'll let you finish it up as we're about closing our PFAS chemicals program and inviting everybody for next Tuesday, the 25th, for the vaccination and also other information, also for the healthy measure, of everybody and safety.
Thank you so much.
Dr. Shelley Tan, we do greatly appreciate. From Voice of South Pacific Broadcast, please keep sharing this one here, because this is a great discussion and a great topic, for the benefit, of keeping everybody safe. Dr. Pakieli, do you have anything to closing up?
Yeah, thank you, Fatima. I just want to thank Sherry Ten and Sam for joining us today, and maybe we should give a big hands for them.
Yes.
Yeah.
Yeah.
Yes.
And my Pacific Islanders people,
Community
thank you
leaders.
for being here today. Just don't stop sharing important information for our community. Love you all.
Thank you. Yeah, this
Yeah.
is all the safety measure. Thank you for all these unsung heroes coming out, and they are the one that taking their time, go above and beyond to serve the community abroad. Victoria, Vicky Navarro, Sam Lowell from the Seattle King County Public Health. Also, Longo, thank you from the Samoan
You're welcome.
community. Lydia Taungono is also, she's the one that running the netball, and she's the head of that in the sports, and she's dealing with that. Thank you so much for getting the energy. Also, Emma Maria, thank you so much. Also, Joseph Seia from the Oceania Northwest, he's the leader. Also, they have another branch in the Snohomish County. So everybody are so busy, and I think we missed out Lydia, from the COPPA, those commissioners, for the Pacific Islanders and Asian, for the governor. But thank you again to, Dr. Shelley. We do greatly appreciate above and beyond. Thank you.
Thank you.
Thank you.
Yeah, we'll have the farewell song here. Yeah. Come on, Lydia. Do the Fijian number. The Fijian haka. Oh, that's Samoan. Go, Joseph.
Yeah.